Hey everybody, Dr. Sorin here. I was going to make a video encouraging everybody to treat COVID aggressively early on, and then also to do everything they can to maintain, uh, optimize their immune system. And I've done other videos prompting that. Now, as I was listening to Patrick Bet-David and Joe Rogan talk, now I follow Patrick Bet-David quite a bit, Valuetainment. He's given me a lot of good business insight. I was listening to him talk to Joe Rogan, and it just blew me away. I'm like, they're making my video for me. And of course, Joe Rogan has a massive influence and massive following, but he actually highlighted another video that I'll put both links down below. But what he points out is that, hey everyone, Dr. Sorin here. And I've been wanting to make a video, and I've been thinking in my head how to do it to encourage people to do early aggressive outpatient treatment and just, for the world to maintain some common sense. And now for the second time, I'm listening to Joe Rogan. First, I heard him describe his COVID experience. And secondly, I heard him talk with Patrick Bet-David on his podcast. He was on there recently. And I have a picture with Patrick Bet-David there, his book up there, and more of his materials there. So I really followed him, because I think he's a tremendous business coach. And but anyway, those guys' conversation was outstanding. I was like, man, I don't need to do the video. These guys have done it for me. So that's where I kind of made the joke of Joe Rogan for Surgeon General. But listen to how he describes his experience getting COVID. Number one, he was up all night, staying up late, drinking. I think he smokes his cigars, doing all that stuff. So he got sick. He got COVID. But what he did is he treated it very aggressively early on. He's like, in his own words, he said he threw the kitchen sink at it. So he did high dose vitamin D, vitamin C, zinc. He did the monoclonal antibodies, ivermectin. I mean, he did the whole works, just threw everything at it, see what would work. And he describes himself as not vaccinated. So he treated it very aggressively the second it started. And I realized not everybody has access to all the things he does, because I think he did IV vitamin C and all these things. But the idea is still there, that he treated very aggressively, and within 3 days, his symptoms were gone. And 2 days after that, he tested negative. So it was very impressive, and just wanted to highlight that. And secondly, he also points something else out, that he was doing all the preventative stuff before. In other words, he was taking vitamin D, and of course he was talking about making sure your weight, because being overweight is one of the huge risk factors. And he even quoted the Israeli study, which I was very impressed that he knew the Israeli study, and I've got it here. Let me just share the screen with you. So here's the study out of Israel. It came out on 8/24. And the thing with Israel, they've got a highly vaccinated population, so they could easily compare the two groups, which guys were vaccinated and if they got infected versus those that weren't vaccinated. There's a small group in Israel that's not. And the numbers are big, so it's a very powerful study. So what it shows here, that those that had the native vaccines had a 13-fold increased risk for breakthrough infection with the Delta variant compared to those previously infected. And if the event was further back, they showed a 5.96, so roughly a 6%, a six-fold, not 6%, a six-fold increase in risk of the infection, and a seven-fold increased risk of symptomatic disease. So that's very interesting, and I want to show that these numbers they had. So here they are in the discussion section. The numbers they had were huge. So our analysis demonstrate that SARS-CoV-2 naive vaccinees, so that means people that have had the vaccine but have not had COVID, had a 13.06-fold increased risk for breakthrough infection. And the risk was significant for symptomatic disease as well. And here they reiterate, if their infection was within this time period, they had a six-fold risk in increased risk in infection. And I just want to show you the numbers here. The numbers are huge. So 63,883 were eligible for the study, and 42,000 were eligible for the study in the other group. So anyway, huge study, very powerful, and gives you some interesting data on it. I'm going to do another video here soon because I got some very interesting info on the stats in Idaho, but just want to highlight those things that he said. And one other thing that Joe Rogan said, was the importance of prevention. And that's what I really want to encourage everybody. Take your vitamin D, take your zinc, take the vitamin C, reduce your weight, get to your optimal health status, because that's going to help you if you do get the disease. And then if you do, treat it aggressively on an outpatient basis, and do everything you can to avoid ending up in the hospital, because you got a lot more problems once you end up needing to be on the CPAP or a ventilator. Your chances of survival go way down. So avoid getting that. All right. Have a great day. Bye-bye.